Hi, everyone. Thank you for joining us. Today on Perspectives, we're talking about recent stories that we've reported that you may have seen where 3 Alabama hospitals discontinued their pregnancy and maternity services within the span of a month last year. Monroe County Hospital in Monroeville was one of those. They closed their maternity services in November, just a few days before Thanksgiving. And that leaves now a hospital in Clark County among the last remaining medical facilities to provide these services for much of the Black Belt region. The availability of maternity services has been shrinking for decades. Nearly 50 years ago, in the 80s, 45 of Alabama's 54 counties considered rural, they had maternity service. But in 2019, only 16 of those same 54 counties were still providing maternity service. Monroe County Hospital cited business factors such as Medicaid deliveries as a reason for ending services. Health officials say that Medicaid simply doesn't pay enough, and hospital labor and delivery operation, they say, can't stay in business if all they do are Medicaid deliveries. The Medicaid fee schedules are not uniform across the state. Doctors are paid less when they go to a rural area. Now, according to the March of Dimes, which studies maternal and infant health-related data, more than a third of Alabama counties have no access to birthing facilities or maternity care providers. More than 27% of Alabama women have no birthing hospital within 30 minutes. Now, a lot higher rate than the national average, which is 9.7%. Alabama's infant mortality rate also among the highest in the nation. It increased to 8.6% in 2021, which is an increase of almost 23% over the previous year. So what can be done to reverse these trends? Our guest today, Dr. Emily Bentley. She's the Assistant Dean of Clinical Affairs and Assistant Professor, University of South Alabama. And Dr. Shanda Scott. She's the Assistant Dean, College of Nursing for Academic Affairs, along with Director for Diversity, Equity, and Inclusion. After a quick break this morning, we'll talk about the challenges of health care in rural Alabama, the shortage of health care providers in the rural areas, and how some health officials say it can be difficult to get physicians to work in the rural area. Doctors Bentley and Scott will share where we are now in the year 2024 as Perspectives continues in just a moment. Welcome back. Today we're talking with Dr. Emily Bentley, as we mentioned, from the University of South Alabama, along with Dr. Shanda Scott. She also there at the University of South Alabama, both in the College of Nursing. Ladies, thank you for joining us today.
Thank you.
You know, this is a subject that I guess growing up in a small town, we had a big hospital, but still a small town compared to Mobile and some of the other areas initially for me. And it's a concern when you hear about some of the things that are happening where women are now having to drive more than 30 minutes to get prenatal care, as well as talking about delivery. That's a whole nother issue as well. And so we wanted to have you on because South Alabama is doing some things to try and be a stopgap in the problem that we're having in the state. But I tell you, I was shocked when I read that it goes back to the 80s to where since that period of time in the last 40, 50 years, we've been losing instead of maintaining that in a state that still has a huge rural part of the state in general. So we thank you for being here to talk about that today. From what you all have observed here in the last 10, 15 years at South, what are you hearing as relates to health care in the rural parts of our region? Because in this area, there are areas that are considered rural. So what are you hearing today?
That's exactly right. So the part of the process is that all of the local areas are losing health care and they're coming to Mobile for health care. So our local health care has expanded significantly, but we have more folks that we can take care of in the region. So the big challenge is how do we get healthcare workers, healthcare providers back out into the rural communities where people are living and working and where they can get better healthcare more local to where they are, because sometimes folks cannot come to us.
And a lot of times you have people who may have left the rural area and they say, well, I'm not going back. I'm just, wanting to stay in the city now. But Are you finding that your nurses are willing, that you all are training and graduating, they are willing to go back to the areas where it's a small or rural type area?
Somewhat. That's our goal too, through education and clinical practice opportunities at the College of Nursing. If we find that if students are provided access to train at some rural areas with rural populations and underserved populations, they may be more confident and competent to seek employment once they graduate as a nurse, whether it's an undergraduate nurse or a master prepared nurse as an advanced practice nurse. They will be more confident to go back and practice in rural and underserved areas. So that's our goal, that's our hope.
Right. And when you see some of the research that's out there, it talks about doctors specifically not feeling they can make enough of what they need. I'm sure some of them are paying off a lot of money for their education also. But the amount that they can earn seems to be a problem. Is that the same for nurses?
It is and it isn't. So one of our big goals here is not only to train nurses to go back to rural communities, but it's to recruit nurses from rural communities to live and work where they are living and working. So that's kind of part of the strategy. And so if you have people that are from that region, they have a commitment to that region, to their neighbors, to work in those kinds of environments.
When you hear the information, and we're talking now where it's been going on for a while, what seems to be the problem in Alabama that they haven't been able to either reverse it or at least stabilize it somewhat? Because some of the numbers where we were talking earlier, like 45 out of 54 back 40 some years ago, but now only 16 of the 54. So what has been the problem stemming that situation and being able to stabilize it somewhat?
I think it's incredibly complex. I think that the way that we deliver healthcare today is incredibly complex. The way that we train healthcare providers, our nurse practitioners, our physicians, our nurses is very, very complex. And then the payment structures have changed so much over the years that, as you alluded to in the intro, there are just not enough cash flow to just pay your folks. So you have to have really unique strategies to combat that. Dr. Scott, do you have any other thoughts?
Absolutely. And then also when you think of the personnel that's needed to support rural hospitals and clinics, you have to have resources to attract the healthcare providers and personnel also. If you lack access to healthcare there, you may lack other resources, schools, decent schools for healthcare providers, and other resources that your employees may seek. So I think it's a complex reason. Of course, people usually seek, of course, better finances or better salaries, and they seek resources for their own families. So if you don't have the providers to support the clinics and hospitals, it's very hard to move forward.
So when you all hear from the ladies who are in those parts of our area, because we've got several counties that are predominantly rural, and now they don't have that to offer except for in Grove Hill and Clark County, what are you hearing from them when they say how difficult it is for them to get the care they need? And we're not talking about just when it's time to deliver, but there's prenatal care that's needed.
Right.
That's exactly right. We hear it all the time. We hear that the fact that they can't get providers to come and stay, and so there's all kinds of strategies that are going on to try to combat that. Can we have folks there several days a week? Can we do some telemedicine? All different types of strategies because it is so difficult to get the care that people need.
Dr. Scott?
To add to that, I know that transportation, of course, is a major issue. We assume that most people have like a reliable car to travel 50 miles or 100 miles for basic care, whether it's for maternal services or emergent care. So what you see is patients, for the most part, staying at home with illnesses that could be cured, but they lack transportation due to whatever type of social circumstance, which exacerbates whatever medical condition that they're suffering from. It's a true challenge that, of course, people usually seek, of course, better finances or better salaries, and other resources that your employees may seek. So it's very complex as far as trying to find solutions for.
I think about my last child. Our doctor left from South and went into private practice over in Pace, Florida, and she was such an excellent physician, though, that I wasn't satisfied with who we were referred to here locally, and so I drove my wife to Pensacola for those checkups, and you know, not having to really think about it, as I'm sure many others will have to do now, considering the rural situation. But we had interstate pretty much to go where we needed to go, and we're talking rural areas that may just be, you know, 2-lane roads in some cases, and other issues that affect making an easy situation to deal with. So we look at the numbers now. Have you all seen a major increase in the last couple of years where you see more women coming from the rural areas to Mobile for their prenatal care?
I've seen a large volume of folks in general coming to the Mobile area for care, spent some time in the ERs and the hospital systems, those types of things. And the volumes of folks that we were seeing in our healthcare systems before the pandemic versus now has changed drastically across the city in all of the different healthcare systems.
I can totally agree. Dr. Bentley and I both had opportunities to work in emergency medicine as nurse practitioners, and every day you are taking care of a family or a person that maybe lives 50 miles or 100 miles out. They're driving great distances, and sometimes to acquire just primary care, and sometimes not truly emergency care. So it's a great hardship on patients from those communities, and your heart goes out to them because, like I stated earlier, the patient can be suffering from like a simple medical diagnosis, but it's exacerbated by the not being able to reach a healthcare provider, a primary care healthcare provider, or a specialist. So they end up suffering longer.
We're going to take a break at this point, and when we come back, we're going to talk more and find out what South Alabama is doing to be I guess you'd say an oasis and a rescue at this situation now in our state. Perspectives continues in just a moment. Drs. Bentley and Dr. Scott here with us today. Welcome back. We're talking to Dr. Emily Bentley and Dr. Sandra Scott about some of the issues with rural health care. South Alabama is, I guess you'd say, the oasis in many cases now for the people who are living in the rural communities outside of Mobile proper. And there are a lot of places that we sort of consider a part of Southwest Alabama, and the need is great in many cases now, what we're hearing. It's just amazing how these things have changed. Was there an effort in the state to reverse this a while back, or just sort of seeing how things go? And I hear of some of the physicians saying, well, we're here, and so the next county, they're close enough, but we're talking 30, 50, 60, maybe 100 miles for some people to get to, say, Mobile now. So why haven't we been able to resolve this? I know you say it's complex, but was there a major effort at one time in the last 10, 15, 20 years?
Well, I can't speak on what happened 10 or 15 years ago, but I know in the last few years we've been fortunate at the University of South Alabama to acquire federal grants to help with improving health equity and improving health access to rural communities in the last few years. So we are very excited. We have a lot of federally funded programs that we're able to offer our undergraduate students as well as our graduate students to support the students as they seek their education, and we hope to return to the rural communities and serve medically underserved populations. And
are you getting students from those areas, I guess, and so you have an opportunity to hopefully instill something and encourage them in many ways?
Absolutely, we are.
Yes, we have several programs that we're working on right now. The one that I'm most intimately involved in is called Nursing Reach. We are partnering with 3 local organizations, Franklin, AIDS Alabama South, and Coastal over in the coast of Mississippi, to take mobile health units out into the rural communities to train our nurses how to care for individuals in rural communities, to improve access to care in those communities, and then to link them to care, the most appropriate and the closest care in the community. So that does a couple of things. One, it directly helps the individuals we help that day, but 2, on our side of the fence, it helps train our nurses how to do that work. Again, we're recruiting from those areas. We have a good volume of our students that come from rural areas. We are lucky enough to recruit from across the country, but a lot of our students live and work in rural areas, and we're able to advance their education so that they have more skills to work in those areas.
And having been around a nurse most of my life, a lot of the nurses can provide today a lot of the expectations you may have of a physician in these areas. Is that one of the things that you all see where you're able to help, where you get a highly trained and qualified nurse into some of these communities?
Absolutely. We have awesome nurse practitioner programs at the University of South Alabama College of Nursing, and a dedicated faculty that helps support the students while they progress through nurse practitioner school. So we have primary care nurse practitioner students. With one of our federally funded programs, we're able to recruit nurse practitioner students from diverse backgrounds and rural communities, recruit the students, support them while they are in nurse practitioner school, and also provide clinical placements or clinical training for those students back in clinical areas in rural communities. So we partner with Franklin Health and Monroe County Health Department to place our nurse practitioner students. They get a chance to work with patients from diverse backgrounds and rural backgrounds, and gain the knowledge that will equip them to go out and work and serve in those areas.
This might not be one that you all have to deal with, but since you do have the College of Medicine and you are kicking out physicians as well, are you getting them now with the idea of, hey, maybe I can serve a rural community instead of going to Mobile, Pensacola, or even larger cities? I think about Dr. Benjamin, and hopefully, is she still teaching there at the university? Maybe she's encouraging some of those young physicians who are up and coming. Rural health care is not a bad situation at all.
Not at all. I mean, we are really lucky at the university in that we have a College of Medicine, we have a College of Allied Health, we have all of these multiple different colleges that are coming together to work on a lot of these things. We have a lot of collaborative grants. Even since I was a student at South Alabama 15 years ago, I did collaborative work with the medical students there, and that's always been part of our culture, and I think that's part of what makes us successful in doing the work that we're doing. Is because we have all of those things right at South Alabama. We work together on all of these projects. There's just so many things that the medical school and the college and the providers that work there are doing in alignment and parallel to the work that we're doing.
So when you look at where we are today and seeing the needs in rural health care, do you see that we're turning the corner in some aspects with what initiatives that you all have now, or what do you see that we need to do if we're not doing that yet?
Well, we are working hard with trying to make sure we turn the corner with our students. By providing our students with as much exposure as possible, we have seen a number of our graduates return to either medically underserved clinics or either rural communities to practice as a nurse or nurse practitioner. So like I stated, that's our goal, to bring that exposure so we can increase healthcare in those communities. And I think we're making progress. I mean, it takes a while and it takes time, but we are making some progress.
And I think in our graduate program, we've made progress for a long time. So one of the things that has helped us get some of these federally funded programs is because we have such a large volume of our students that are already in these rural areas. We were a leader in online education for a very, very long time. And so what that does is, just like the telehealth model, where we can bring our expertise out into the rural areas, we've been able to recruit from those rural areas, and then these types of federal projects just advance that effort. So we've been doing this in a long time for nursing, and these projects are pushing forward in that regard. So I think, as Dr. Scott says, we have a long way to go, and because we are still losing services in those communities, but we have, I think, at least turned the corner to realize, okay, this is a real problem, and these are some resources and these are some strategies to address the problem. I think historically we have done things like, okay, let's look at your own community and see what you can do for your own community, to more global, to say, okay, what can we do for our region? And I think that's really kind of the big model shift that we've been focusing on.
I know back in the old days, it was always a thing you'd hear from medical, both physician and nursing, saying, yes, I'm going to go and get this and go back to my home and be inspiration and to be of help to addressing those medical needs in my community. So do we need to do some commercials on that now, you think?
Absolutely. Any kind of marketing or advertising you can do to promote rural health and to promote health care and best care.
And a lot of times that's where we get our most committed students still. They are committed to going back to serve in the areas that they were born in, they were raised in. So that's important. They're truly vested in helping the community that they've grown up in. So that's always important, and a special touch.
That's right. Dr. Scott, Dr. Bentley, we thank you both for coming and sharing today, and hopefully this will be of encouragement to those who may be thinking of the nursing profession or as a doctor to get their education at South Alabama and head back to serving their community. Thank you both, ladies.
Thank you
so much for having us.
And for more information about the nursing program at the University of South Alabama, you can check out their website at southalabama.edu/CON, that's College of Nursing, or you may call that number as well for more information. Well, thank you for joining us here this Saturday morning on Perspectives. We've got more episodes for you online at fox10tv.com. Till next time, I'm Eric Reynolds. You have a super day.